Welcome back to the Deep Dive. Today, we're tackling a really big day in the fertility journey, maybe one of the most intense ones, egg retrieval day. If you're going through IVF, this is it, the culmination of all those weeks of injections, monitoring. It's a huge moment. So our goal today is to cut through the medical speak and give you the real deal, practical info prep, what happens, recovery, so you feel, well, less stressed and more ready.
Exactly, and that stress is real. But honestly, understanding the process, what the steps are, why the timing is so vital, how they keep you comfortable, it really does empower you. It makes the unknown feel, well, less unknown.
Okay, so let's start with the basics. Egg retrieval or follicular aspiration, what is it exactly?
Right, it's basically a minor surgical procedure. The goal is simple.
Yeah.
Collect the mature eggs from your ovaries.
Yeah.
These are the eggs the lab needs to start the IVF or ICSI process.
And the actual time the doctor's doing the collection. It's surprisingly quick, isn't it?
It really is. The procedure itself, usually only about, say, 15 to 30 minutes. But it's not the length of the procedure that's the main thing here. It's the timing before it. It has to be incredibly precise.
Oh, okay. And that precision, that hinges on the famous or maybe infamous trigger shot, right? Why is that one injection so make or break?
Well, the trigger shot is kind of the final signal. It's a hormone injection, usually HCG or a GnRH agonist, that mimics your body's natural LH surge. That surge is what puts the finishing touches on the eggs, makes them mature and ready to be collected, and the timing is everything. The retrieval must be scheduled, like clockwork, 34 to 36 hours after you take that shot.
Wow, that's a tight window, 34 to 36 hours?
It is, and it's critical for two reasons. One, it ensures the eggs are fully mature, usually when the follicles hit that sweet spot of 16 to 22 millimeters. And two, it prevents them from ovulating, from being released before the doctor can get to them.
So if you miss that window,
Yeah, if you miss it, even by a bit, you risk either getting immature eggs or, worst case, the eggs ovulate on their own, and the cycle might have to be canceled entirely.
okay, that really drives home why the clinic gives such specific instructions. You have to follow them to the absolute letter.
Absolutely. Double check the time, set multiple alarms. Don't hesitate to call the nurse if you're even slightly unsure. Seriously, ask 3 times if you need to. It's that important.
Got it. So moving on to preparation, this starts well before you even walk into the clinic, right? Mainly focusing on safety for the sedation.
Exactly. The number one rule, the non-negotiable one, is fasting. You absolutely cannot eat or drink anything, and that includes water, gum, mints, everything, for usually 6 to 12 hours before your procedure time. Your clinic will give you the exact cutoff.
Why is that so strict?
It's all about the sedation. If you have anything in your stomach, there's a risk, albeit small, that you could aspirate, meaning stomach contents go into your lungs while you're sedated. That's a serious complication we want to avoid completely. So no matter how thirsty or hungry you get, stick to the rule.
Okay, solid motivation there. Besides fasting, what about practical things like what should you wear? What should you leave at home?
Think comfort. Your ovaries are going to be enlarged, probably a bit tender. So loose clothing is your friend. Elastic waistbands, maybe sweats or comfy pants. Slip-on shoes are great too because bending over might be uncomfortable right after. And leave the extras at home. No jewelry, no makeup, no perfume, and importantly, no nail polish, especially the gel or acrylic kind.
Oh, why no nail polish?
They need to put a little clip on your finger, a pulse oximeter to monitor your oxygen levels during the procedure. Nail polish can interfere with the reading. And definitely remember to bring a sanitary pad for afterwards. Some light spotting is really common.
Makes sense. What about activity levels in those last few days before retrieval? Should you be taking it easy?
Yes, definitely. Avoid any heavy lifting, strenuous exercise, and also sexual intercourse for a few days leading up to it. Your ovaries are bigger than usual because of the stimulation meds, and there's a small risk of something called ovarian torsion where the ovary twists. It's rare, but best to avoid activities that could potentially increase that risk. Keep things calm. Oh, and a quick note for partners, if they're providing a fresh sperm sample on the day, they should usually abstain from ejaculation for about 2 to 5 days beforehand. That helps optimize the sperm count and quality.
Right, good point. And the big one related to sedation getting home. You can't drive yourself, can you?
Absolutely not. This is crucial. Because you've had sedation, you must have a responsible adult drive you home. And not just drive you, they need to stay with you for a full 24 hours afterward.
24 hours, why so long?
The sedation effects linger longer than you might think. Your judgment, coordination, memory, they're all impaired for a while. You can't safely drive, operate machinery, make important decisions, or even really navigate stairs alone. You'll feel groggy, maybe a bit out of it. Having someone there is purely for your safety. Plan that ride and support person way ahead of time.
Okay, logistics covered. Now, the part everyone worries about. The procedure room itself. Let's tackle the big question. Will it hurt?
That's always the top concern, understandably. And the answer is no, you shouldn't feel pain during the actual retrieval. They take really good care to make sure you're comfortable.
How do they manage that? What kind of anesthesia is typically used?
The most common approach is conscious sedation, sometimes called IV sedation or twilight sleep. They give you medication through an IV, usually a mix of pain relievers and mild sedatives. You'll feel very relaxed, maybe drift off into a light sleep. Crucially, you won't feel pain, and most people have little or no memory of the actual 15-30-minute procedure afterwards.
Okay, that's reassuring. And while you're sedated, someone's keeping a close eye on things.
Absolutely. Safety is paramount. There will be a trained anesthesiologist or nurse anesthetist right there with you the entire time, constantly monitoring your vital signs, your heart rate, your blood pressure, your oxygen levels. It's continuous monitoring to make sure everything is stable. Complications are rare, but the team is fully prepared.
So once you're comfortable and monitored, how does the doctor actually get the eggs out? They're microscopic inside the follicles. How does that work?
It's actually a very precise technique using ultrasound guidance. The doctor uses a transvaginal ultrasound probe, similar to the ones used during your monitoring scans. This gives them a clear, real-time picture of your ovaries and follicles on a screen. Then, guided by that image, they pass a very thin needle through the top of the vaginal wall directly into each mature follicle. It sounds intense, but it's done very gently.
And the needle does what?
It's connected to a gentle suction device. The follicular fluid inside each follicle, which contains the microscopic egg, is carefully aspirated, gently suctioned out.
Okay, so the fluid with the egg is collected. Where does it go immediately?
Straight to the lab. Usually the procedure room is right next door to the embryology lab. As the fluid is collected, it's immediately passed to the embryologist, who takes it, puts it under a high-powered microscope, finds the egg, and assesses its maturity right away. It's a really coordinated team effort.
Wow, okay, so the procedure's done, the eggs are hopefully collected, you're moved to recovery. How long are you typically there before you can go home?
Usually about 1 to 2 hours. It just gives time for the main effects of the sedation to wear off while you're still being monitored. You'll likely feel pretty groggy, maybe a bit nauseous, and probably some mild cramping, kind of like period pain.
And the big question then is, how many eggs did they get? When do you find that out?
They know that weight is tough. So usually, you or your partner will get an immediate update on the total number of eggs retrieved pretty soon after you wake up in recovery. That's the first piece of news.
Okay, just the number initially. What about things like quality or maturity?
Right, those details come later. The embryologist assesses maturity right away in the lab, but you might not get that specific info immediately. The next big update is usually the following day, day 1, which is the fertilization report. How many eggs successfully fertilized with the sperm?
And then you wait again for updates on how the embryos are developing.
Exactly. You'll get updates on how many embryos are growing, typically looking towards either a day 3 transfer, cleavage stage, or more commonly now, a day 5 transfer when they reach the blastocyst stage.
So, assuming things go well and you have embryos, the transfer is the next step, usually 3 to 5 days later.
That's right. Day 3 or day 5 is the typical window for the embryo transfer.
Now, once the eggs are retrieved, the body's hormone situation changes.
Yeah.
Right. We always hear about starting progesterone supplements almost immediately. Why is that so vital?
Yes, that's absolutely critical. The process of stimulating the ovaries and then retrieving the eggs, specifically aspirating the follicular fluid, disrupts the cells that would normally form the corpus luteum. The corpus luteum's job after ovulation is to produce progesterone.
And progesterone is needed for?
Progesterone is essential for preparing the uterine lining, the endometrium. It makes it thick, vascular, and receptive, basically, getting it ready for an embryo to potentially implant. Since your body's natural production is likely insufficient after retrieval, you need to supplement it.
How is that usually done?
Most commonly through vaginal suppositories or pessaries or sometimes intramuscular injections. This progesterone support continues usually through the first trimester if pregnancy occurs to maintain the uterine lining.
Okay, that makes sense. Let's shift to recovery at home then. What's considered normal to feel in the first day or two?
It's normal to experience some mild to moderate discomfort. Think cramping, similar to period pain. Bloating is very common. Your ovaries are still enlarged, plus hormones are shifting. You'll likely feel quite tired, fatigued. And as we mentioned, light spotting or a pinkish discharge is also pretty standard. These symptoms should generally start getting better within a couple of days, say 48 to 72 hours.
And how best to manage that discomfort?
Rest is key. Really take it easy for the first 24-48 hours. Stay super hydrated, drink lots of water, maybe electrolyte drinks. For pain relief, acetaminophen like Tylenol is usually recommended. It's often advised to avoid NSAIDs like ibuprofen or aspirin unless your doctor specifically says otherwise, as there's some thought they might interfere with implantation.
What about heat?
A warm compress or heating pad on a low or medium setting can feel really soothing for the cramping. Just 15-20 minutes at a time. And definitely avoid strenuous activity, heavy lifting, or any twisting movements for a day or two. Gentle walking is usually fine, but listen to your body.
And hygiene. Baths, okay.
Showers are fine, but hold off on soaking in a bath, hot tub, or pool for at least 24 to 48 hours just to minimize any risk of infection.
Okay, that covers normal recovery. But it's crucial to know when something isn't normal. What are the warning signs that mean you need to call the clinic right away?
This is so important. Knowing the difference between expected discomfort and a potential problem is key. You need to contact your clinic immediately if you experience signs of severe OHSS, ovarian hyperstimulation syndrome.
What does severe OHSS look like?
That would be severe or rapidly worsening abdominal pain, really significant bloating that makes breathing difficult, rapid weight gain like more than a couple of pounds in a 24-hour period, nausea and vomiting that prevents you keeping fluids down, or difficulty urinating or shortness of breath.
Any other red flags?
Yes. Signs of possible infection or significant bleeding. So heavy vaginal bleeding, soaking through more than one sanitary pad per hour for 2 consecutive hours, chills or a fever, or any foul-smelling vaginal discharge.
So if any of those things happen, don't wait. Just call.
Don't wait. Call your clinic immediately, day or night. They have protocols for this.
Yeah.
While serious complications are rare with egg retrieval because it's so monitored, being aware of these signs is critical for getting prompt care if needed.
That clarity is really helpful. There's often so much focus on the number of eggs retrieved. Everyone hopes for that good number, maybe 10 to 15. But let's end this part on a positive note. What really matters most?
It's true, we get caught up in numbers. And yes, having a decent number gives the embryology lab more to work with, more chances. But ultimately, quality trumps quantity. A smaller number of high-quality, mature eggs that develop into healthy embryos is far better than a huge number of poor-quality ones. The goal isn't just eggs, it's a healthy pregnancy. So while the number is information, the quality is really where the potential lies.
That's a great perspective. This has been so useful, really demystifying what can feel like a very clinical and, frankly, nerve-wracking procedure.
I hope so. The main thing is you've put in the work during stimulation, you understand the timing is key, and being prepared really does reduce stress. And crucially, knowing what's normal recovery versus what needs a call empowers you to navigate the post-retrieval period safely.
Okay, before we wrap up, our important reminder. It is important to remember that everything we have discussed in this deep dive is strictly educational and is not a substitute for professional medical advice. Always consult your doctor for personalized medical guidance. And if you're looking for more information about the whole IVF journey, you can find more detailed information about the complete in vitro fertilization process on the portal, ivfforme.com.